French medical workers are exhausted. COVID-19 infections have surged across the country in recent weeks, and World Health Organization projections predict it's only going to get worse.
We've had no extra beds since the first wave. In fact, it's as if the first wave never ended.
There's a lot of anger among our ranks and also among doctors because President Emmanuel Macron made so many promises but only gave us a bonus. He didn't add staff in our units. What we need is more people in our teams because we're just overwhelmed.
Paris is one of the worst affected cities in the country. At this hospital in the capital, staff are preparing for a long winter.
We tell ourselves that the first wave was a sprint, and now it's going to be a long-distance race, I think.
40% of intensive care beds here are already occupied by COVID patients.
We are inevitably going to be told at one time or another that 100% of the beds in Paris hospitals are full of COVID patients. What are we going to do then with other patients?
On Saturday, a curfew comes into effect in Paris and 9 other cities to combat the soaring infection rate. The government says it hopes the curfew from 9 p.m. to 6 a.m. eventually reduces new cases to 3,000 a day. That's 10% of what's being reported now. Curfews and other restrictions, like shutting restaurants and bars, are also being reintroduced in other parts of Europe. Germany, the Netherlands, Italy, and Poland are among the latest countries to announce new measures. As the continent passed the threshold of 1,000 COVID deaths daily, the World Health Organization says European governments have to crack down on behavior that spreads this deadly disease. Natasha Hussain, TRT World.